Myrick.
Thank you, Mr. Chairman. We're here to mark up a bill that attempts to solve a health insurance problem faced by millions of Americans who don't have access to affordable insurance. Some of them can't get it because of pre-existing health conditions or because they've lost their job. For some, an employer has decided that he or she can't afford to offer coverage anymore, and the self-employed have limited ability to buy on the individual market. Some don't get coverage because they don't consider it a priority. Others don't elect to be covered because it's just too expensive. Healthcare costs are holding Americans hostage. Unfortunately, the amendment in the nature of a substitute released last night and before us today doesn't solve these problems. The Congressional Budget Office has not yet been able to indicate a true cost estimate or coverage impact estimate because they've had limited time to analyze the bill. But CBO is able to say that this bill does nothing to bend the cost curve that's been discussed so often in the last several months. This is bad news. A bill that does nothing to change the long-term cost of health care in this country and saddles the federal government and future taxpayers with unsustainable levels of debt is a terrible idea. It's a terrible idea anytime, but it's especially terrible in the midst of a recession. In response to some of these concerns, some of my colleagues will say, well, we must do something. This is true, we must do something. The current scenario can't continue into the future. It's unacceptable that a family of four pays thousands in monthly premium costs when they buy on the individual market. It's unacceptable that medical bills routinely bankrupt Americans who thought their insurance would cover them. And there's no excuse for that. But there's also no excuse for saddling our grandchildren with insurmountable debt, and no excuse for creating a system in which many Americans stand to lose their private coverage. There's no excuse for creating a government health care system that will keep some from getting the life-saving care that they need. And there's no excuse for pushing these massive changes, full of unintended consequences, through Congress just because some think the moment is right. And I yield back.
Thank you, Ms. Myrick.